we're not even through CPR.
All right, so we're back on, so the camera decided to go. So, yeah, so like I was saying, the layperson CPR is gonna be different than CPR that we typically provide. So, why don't we take a break, and then we'll talk about automated external defibrillators.
You know, the best part is getting here again in just a little bit.
No, I'm excited to
Listen,
sit.
do you want to take a mid-break and let you and me do butt PowerPoint so you have those?
Yeah, right. I'm excited to sit through again. Not really. Sorry, you have to.
He's got this thing on, I do.
gonna be rough.
All right, well, who knows how much longer this thing is before it cycles again. Make sure it's still recording. Sure is. All right. After that nice, refreshing break, let's get good luck doing it this way, champ. It takes a minute to cycle through this way, like it's not. Is somebody making cookies or something? This one smells nice. Oh, did you add some stuff in here too? Look at you.
I did. Just something small.
Oh, okay.
I did a lot of work.
All right. Jeez, every guru. See, that's why they can't get anything
I
done
wouldn't-
because
I don't
every
like to print
goofball
it.
comes in here and it's.
I printed this for you.
Yeah, I was gonna print that after, but yeah. Weber was like, hey, you can print that later. I'm like, okay. All right. 80s, man, you see these things mounted everywhere. So it's almost to a detriment because it's just like seeing anything else. You don't really probably pay attention where they are. Obviously, we know where ours are on the rig and stuff like that, but they are hidden. So, and they're not hidden, but they almost seem hidden because you see them everywhere. So you don't really pay attention to where they're at. And most people, for the most part, probably aren't trained enough on it, but they're almost idiot-proof. You pretty well turn it on and it'll tell you how to do it. Now, I'm sure there's always those times where you go to put one on somebody and you're like, okay, which hat goes where? Because we don't do it super often. So you go to do that, put it on somebody's chest, and you're like, oh god, the big one goes, and then this one goes, okay. But half the time they got pictures on them on there, so you just go with what the pictures have. So, obviously you're going to maintain doing, if unsuccessful, or even if you were successful, you're going to follow those prompts. And those prompts are going to tell you to proceed to manual CPR. You should have probably already started CPR. Before you kind of started this, and then you're going to briefly interrupt it to put those pads on and let it go, and then it's going to coordinate after that. So it's going to tell you, when it's wanting to shock or when it's going to analyze and all that jazz, and then you're going to step away. So you just follow the prompt, but you're going to be doing CPR all throughout using that thing. So obviously CPR, when you're doing it, you're compressing the chest, thus moving blood around the circulatory system and keeping that brain alive is what we want. The rest of the body can hang out for a while, but that brain can't go very long without any oxygen, so we got to keep blood going to the brain. Well, yes, you are going to perform CPR in different ways. Obviously, most adults, honestly, smaller kids and up are going to be pretty well the same, but babies and whatnot, there's going to be different methods to doing CPR. You can't just barrel down on a kid's chest like that, or a baby's chest. That's not going to go well. So there's different methods of doing that. Yep, they're stressful for all involved, like we were talking about earlier. They're not fun. You feel gross, and that's all the the family and the stress and everything goes into all that. So typically unexpected. Yeah, I want to say it's less unexpected for us, I guess, because we kind of get a heads up, because that's the whole reason we went. So we get the whole drive there to think about what we're going to do and how we're going to do it, because you kind of, a lot of times call notes can kind of give you a vibe of whether you're going to be doing it or not. So. And it may be in progress. There's not very many, I can count on more times I've seen bad CPR in progress than I've seen effective CPR in progress. Or they're overdosed and they really don't need CPR, and they're hunched over in a chair and there's somebody's just like trying to do CPR to somebody upright in a chair. You're like, no, or my favorite, they're breathing and somebody's giving them mouth to mouth in a library. Were you there for that?
Yeah.
That was so gross.
She thought she was doing a
Oh,
hero.
poor thing. She thought she was
It's like you didn't have to.
It was at the library or whatever, and I'm
Yeah,
not going to say
downtown.
anybody's names. Downtown
On the
library.
square.
So
I
it's
remember.
pretty much just like a homeless bathroom anyway. And we get a call on the way there that CPR is in progress. So I mean, like we're like, oh, all right. And then it said, because it was JD, wasn't it? It was said mouth to mouth in progress, and it was like, huh? Like, surely they don't mean mouth to mouth in progress, because they don't teach that anymore. It's a pretty short list. So we get there and we walk all the way back, and this poor librarian, this guy had overdosed, and he was in the bathroom stall. And I think I got to him first, because I think you were driving.
Yeah.
And the lady was there, and she gets up, and she's kind of like, she's all frantic, because it's stressful. So I mean, so she thought she was doing what she could. So she was just giving just raw mouth to mouth to this gentleman on the ground. And I'm like, okay, I'm not doing this in a bathroom, because another thing with CPR is, you're going to find them in odd places. They're going to be in the bathroom, or they're going to be in a hallway. Screw that noise. Like, you're going to grab them, you're going to drag them to an open area. If they're between these tables, I'm bringing them right here. Like, you make room, like, cause you wanna get there and do whatever you wanna do, but like the area, cause it's gonna take a lot of room. I go to move him and he's like wet. I can feel him through my gloves. He's just wet and damp. And as I go to drag him out in this hallway, he goes, ugh, and just sits up. And he's breathing. And he just he had just slightly overdosed, essentially is what it was. There was a spoon on the toilet, and he has a little kit of shit that he was using to get high with or whatever. And she's just like, and JD's like, you might want to go get looked at and checked out because you were not using BSI, sensei. So, yeah, no PPE was used in her case. So we didn't do anything for him because he was, yeah. So she just was raw dogging some dude in the mouth. It was a what? So no bueno. So definitely be unexpected and awful, and yeah, write that in there. Yeah, there'll be a test later. So it can be stressful. Yeah. So first priority after doing PPE is to determine the condition of the patient. Doing your PPE or donning your PPE, you definitely want to have that on. All right. So like we said earlier, layperson CPR is going to be more of like the hands only that they do right now. And that's a greater emphasis on compressions other than ventilation. So ventilation is definitely helpful, and it's definitely good to get that O2 in there. And for us, that's something we're going to be doing. But if they're going to do anything at all, compressions is the way to go. So yeah, we're all certified in CPR, BLS. Even the CPR that we're certified in is closer to the generic CPR than it is to realistically what is done. So yeah, determining consciousness is definitely the way to go. Like with that gal, she probably could have maybe been like something, maybe a little sternum rub, a little poke. Skinner likes to poke him in the eyeballs. That's good and creepy. You see him do that?
Interesting.
Yeah. He's like, I don't know, and I'm like, oh God. All right, yeah, I guess not. So I mean, you can. I think that was like some army medic stuff, but like it was like, okay, flick me in the eyeball. So, but if they don't react, they're not vacant, you know. So definitely determine if they're conscious, and then if they're conscious, then you're good. But if they're not, then you're going to go for that pulse. So, and like we were saying earlier, carotid's usually the best way to go. So, and you're going to start compressions obviously right away. So you want to tilt that head back and get right into it. So, I pulled up on people doing bad CPR. You definitely want them laying on their back on a hard surface. If they're on a bed, you're just riding the wave at that point. You might as well get a surfboard because you're not doing any good. So it's better to get them on the ground and find the correct location. They're referring to your chest, but like I would say, find the correct location to do CPR. It's going to take a lot of room. And yeah, Champ's over there touching his chest. Yeah, definitely. Hey, but you'd be surprised, like proper placement, because that happens now. And proper placement is something to think about too when you're doing CPR. Is that stupid metronome that they've got on there, like, it'll slide off, and then it's like, you press harder, and I'm like, I'm gonna throw you out the window. I'm pressing fine. Or just know when to tell yourself, all right, I am getting tired. It is time for me to go. Because your hands start slipping, you get sweaty in those gloves, and it smears on them, and that stupid metronome pad is not a good placement to push on, and it moves around because it's sweaty and gross and vomity and bloody and weird. So proper placement. If you notice you're starting to slip, maybe it's time to cycle in another person to give you a chance to take a breath, because it gets exhausting. So yeah, we're gonna go over this. Obviously, you guys already know how to do CPR, but definitely want them on their back, tilt their head back. If they're crunching in on themselves while you're doing CPR, that airway is not open. So you want to make sure that somebody is either maintaining that airway open, especially known with us, we're going to probably have an eye gel in there already. But definitely maintaining that airway you're doing, because the O2 is getting in there, and if it's not getting in there, it's not going to do any good. And if it's getting to the wrong place, it's not going to do any good. I don't think the eye gels are pretty good about seating. We used to have like combi tubes and stuff when I first got my EMT license. Man, if you didn't set those tubes in there right, you're filling their stomach full of air. And a bloated stomach full of air is just a vomit bag waiting to pop. Like, it's gross. So the eye gels are super nice. I really haven't run into any problems with an eye gel.
Every now and then you can't get one all the way down. Then
Yeah.
I stop. If it doesn't go down easy, I don't.
Right, but then I'm always like, am I going to fill the wrong spot, type of situation. But usually people have different throats, so they don't always go down as far as they should. But I think people bottom out sooner than other ones. I mean, but for the most part, I want to say 90% of the eye gels that I've put in have been pretty easy, really. Definitely you wanna side
Move
with
it
it.
up.
Yeah, no, and then some people are better with that than others, so I always just like get real gross with it, like you might as well. So, you don't wanna have to reapply, so. And it just goes with proper lifting practice and anything else, like if you're leaning way back and you're trying to push out in front of you, you're not gonna be effective, use your body weight. If you're getting, he's got his shoulders up over his arms like that, he's able to push his whole body weight into that person's chest. If you're Rosie, leaves a heck of a crater in somebody's chest for you to follow. Then you don't have to worry about proper hand placement because you're like, oh, the dent in their chest, that's where I'll put my hands. Gross.
Where it gets hard is when there's fluids all around and you're trying not to get into that and then have perfect position.
Yeah, have perfect position. Cause like one thing we try not to do, he's got both his knees next to that person on the floor.
That person ain't got no arms.
Well, that's handy, yeah, cause they've got arms and that person probably isn't that small. And they got legs, so they're probably heavier than that, or they're just old, and that's the other thing they don't talk about. You're breaking ribs. If you're doing CPR right, you're breaking ribs, or you're at least dislocating that joint, because it's technically a joint.
Cartilage and stuff.
Yeah, it pops terrible. Or if it's Rosie, it breaks. So,
Pierces the heart.
yeah, and that's kind of a weird thing as you're going, because you want to be like, oh, whoa, like no, they're dying, so get after it. But you're definitely popping.
Not gonna hurt them much more.
No, but it's, when they're 80, it's grandma. She's frail.